Good evening. Once again, we are back. This is our second IVF webinar tonight. So I'm very happy that we were able to discuss one of our topics tonight. And now we will go to the next one. This time we will talk about IVF legislation in Russia. So again, we have our special guest, our presenter, Dr. Diana Bidniak. Some of you might already know Dr. Bidniak, as she's been here many times before, and it's always a pleasure, and we are always happy and excited that you will talk about this particular topic indeed as well. So hello, Dr. Diana, how are you feeling? It's great to have you.
Hello. It's a pleasure to see you once again, to see also all the participants. Thank you so much for your time, for your attention. So I'm very ready to present to you this very specific topic, as I already said, Caroline. I bet it would be interesting.
For sure, no doubt. This is always good to find out, because I think that not everyone is actually familiar with the legislation in Russia. So you are the best person to discuss it for sure. So let me just mention that Dr. Diana Obidniak, she is the head of Art of Birth Clinic, which is located in St. Petersburg. So as you might already know, she's been with us many times. She has lots of experience, and I always love how passionately she speaks about any topics that we have. So she wants to, I know that she handles all the topics very nicely, and tonight this is definitely going to be interesting, no doubt. So remember, it's going to be recorded. Now we will start with Dr. Diana's presentation, but afterwards, as always, it will be time for your questions. Don't forget to put those in the chat section. Dr. Diana will be definitely able to help you out with those. Okay, and let's get going with the presentation. Okay?
Okay, so for sure today we will talk about, as we said, very specific topic, but it's always very useful to know some law features, especially in the 21st century. So, but in my opinion, when we talk about legal regulation in IVF, especially, is often a reflection of social perceptions and ethics. That's why I would like to start with, ethics, origin, and correlation between ethics and IVF practice. So nowadays, we all know that tolerance and respect is a standard in medicine. But if we talk about IVF, from the first approach, ethics and IVF were very connected. Unfortunately, in the very beginning of appearance of our medical area, perception of patients, perception of social of public wasn't so friendly. In 1930, the first paper about first successful IVF trials in vivo on model of animals were published. And in 1936, New York Times published a paper called Advocates of Raised Better Men, meaning that it's abnormal to make IVF treatment and even to think over and make trials on animals. In 1940, started discussion that men would be excluded from the reproduction. Even they told the mythical land of the Amazons would then come to life. The second wave of antagonism and of haters appeared when the first delivery or the first IVF baby resulted in 1978. John Biggers, one of the pioneers of IVF in the United States, described published public discussions in Virginia. The entire meeting turned out to be a shouting match. The two groups, pro-lifers and IVF proponents, hurling inside each other. So nowadays we have the same things, we have the same issues, because there are a lot of questions around IVF which require legal regulation. However, our opinion of the physicians, opinion of patients, opinion of international associations of IVF specialists, of fertility specialists, take part in this legal regulation. So the first question, how old is too old? The American Society for Reproductive Medicine sets a hard line. Embryo transfer should be strongly discouraged or denied to any woman over age 50 with underlying issues that could increase or further obstetrical risks, and discouraged in women over age 55 without such issues. In Russia, we do not have legal age limits. The decision is taken according to individual status of the organism and according to international IVF guidelines. But usually, after 50 years old, we recommend surrogacy program because our aim is not only to get pregnant and to help you to get pregnant. Our aim is to bring healthy baby and not to, jeopardize any risk on your health. I believe that being born is better than not being born. And I will discuss with you all the issues precisely in these terms. For sure, the second questions in terms of legal regulation in each country is associated with practice with single women and one-sex couples. In 2013, in the United States, Committee Opinion of American Society for Reproductive Medicine called for programs providing IVF and other fertility services to treat all requests for assisted reproduction equally without regard to marital partner status or sexual orientation. Thus, we also just think in the same way. In Russia, IVF is legal in all cases except one, embryo adoption plus surrogacy. I will explain why this combination is not allowed. Because in Russia, we have to defend that there is a genetic association between baby and at least one of the patient. So in case single woman has donor sperm and we use her own eggs, we can use surrogacy. Or single woman can use egg donation and sperm donation, but we will make embryo transfer into her uterus. Talking about PGTA, because we have to talk about this, not in all countries is so widespread as in the United States or in Russia. But I would like to remind you that very, very recently, just in 1990, worldwide discussion was in terms of Catholic babies. So it wasn't considered as a good idea. Even that we have several law cases when there were sanctions, precisely in Italy and Latvia, when patients were rejected to perform PGTA. And always law was on the side of patient. In Russia, thank God, it's absolutely legal, and we implement PGTA in our practice very widely because our aim is to help you to become a happy parent. And as a woman, I always think not only about the pregnancy or positive HCG test, we also think about live birth rate. That's how we, measure our KPI and our effectiveness. Sex selection. So non-medical sex selection is not allowed in terms of discrimination. It means that in case for some persons is okay the idea of utilize the embryos of specific gender is not allowed in Russia, but for sure as in cases we make PGTA, we examine all the chromosomes including the genital ones. So in standardized international report on PGTA, there is indication which of the embryos is boy or male or female gender. So in case we both have a healthy baby, a healthy boy or healthy girl, for sure we ask the question if it's important for intended parents. The other thing which is very, very interesting is the new technology called PGTP. Given this, thanks to this technology, we can select the embryos with no, we can provide genetic testing for polygenic diseases, for example, diabetes. So I have shown on this slide one of the papers dedicated to this trial about preimplantation genetic testing and relative risk reduction. So nowadays we have approach how to select the embryos with minimal risk of diabetes. It's extremely important in cases when we have some risk. For example, one or the intended parent has a medical history of diabetes, and for sure he or she doesn't want such a destiny for he or her babies. However, the next question is, being born is better than not being born. So is it ethically normal to make this PGTP testing? Is it discrimination or a new norma? Nowadays we have no answer, and I think that each of us can make response, and I bet that there is no right or false answer. But I want to invite you for thinking over about our technology and thinking just precisely for you, is it normal or not? Because I want you to just play a game, because just very recently we have seen that in 1930 IVF technology at all was considered as something strange and not associated with science. So nowadays we have more and more abilities, more and more approach, not just to help you to get pregnant, but also to guarantee you that your baby will be healthy. But sometimes it provides different concerns. So egg donation. Egg donation in Russia is totally legal, and I want to share with you is a draft, is a preview of good practice recommendation for information provision for those using and participating in reproductive donation. I'm a national representative of Russia at the ESHRI committee, is European Society for reproduction and embryology. So you can check, and you can read this preview. For me, it was a bit strange that this is very new guidelines for practice in donation, but there were no mentioning of COVID-19. But in each country there are a lot of guidelines which are rather similar to from country to country, how to minimize the risk given new status in the world. So we also take this and take it into the account. But I want to share with you, general indications and general terms of who is the donor in Russia. So according to our law, the following requirements are to become a donor. The age is from 18 to 35 years old, but to say the truth, we very, very rarely invite to participate in program donors who are older than 31 years old. Because as we know, there is a strong correlation between the age of a woman and the risk of abnormal embryos. That's why, for sure, we have medical indication that we have enhanced risk after 35 years old, but as we take responsibility, we always try to minimize all the risk. That's why we usually have donors who is not over that 31 years old. Physically and psychologically healthy, no addiction, so we provide specific tests to approve it. For sure, we provide genetical testing. No requirement to have own children, but we make specific match of monogenic diseases with intended parents to minimize the risk that any rare diseases will appear after delivery of baby. Both anonymous and individual donation are allowed. A patient could come to the IVF clinic with with his or her own donor, but we will still have to provide all the specific testing according to our law. That's why usually patients prefer to share this responsibility with specific agencies or clinic. Talking about surrogacy program, we have a rather intensive experience in Russia in terms of surrogacy program, because the first surrogacy program in Russia was implemented in 1995 in St. Petersburg, and the general public opinion is very surrogacy friendly. For sure, all the program, if we talk about egg donation or PGTA or surrogacy program, we always have to approve medical indications. So for surrogacy program, we also have specific medical indications. Usually they are associated with various diseases due to which childbearing is contraindicated, or for example, repeated unsuccessful IVF transfers, or untreatable adhesions inside uterine cavity. So there should be just contraindications for childbearing or inability to have successful implantation. Who is eligible to be a surrogate? It's always we only consider women under 35 years old with own healthy baby born naturally, so no cesarean section. We also provide full information about her medical background, education, habits, and so on. Even usually patients are very welcome to make a meeting with a surrogate mother and make any contact by phone, or to have meetings as many as it's needed. Surrogacy is resulted by the Family Code of Russia. So persons who are married to each other and who have given their consent in written form to the implantation of an embryo in another woman for the purpose of bearing may be entered as parents. Law features. No adoption, no court decision is required. The surrogate's name is never listed on the birth certificate. It's very important point, because in case intended parents do not want to disclose this information for anybody, it's a very crucial point. The surrogate irrevocably loses all rights to the child. There is no requirement for the child to be genetically related, at least one of the commissioned parents. Children born to heterosexual couples who are not officially married or single intended parents through gestational surrogacy should be registered in accordance to analog of JOS. So a court decision might be needed for that. And commercial surrogacy is not prohibited. I've told that don't waste your embryos, meaning that nowadays, given pandemic situation, for sure we have a lot of inquiries and a lot of tasks from our intended parents that they cannot reach us. That's why we also have an experience of shipping the embryos or sperm. It's totally legal and is available. it's just necessary to provide all the medical tests and embryo vitrification protocol. I bet that the right to procreate is a natural right of any human being. Any person with limited reproductive abilities who wish to become a parent through surrogacy or any other IVF technology should be given a chance to make this dream come true. Every person has a right to parent a child. Every child has a right to be born. And being born is better than not being born. Thank you for your attention. I'm ready to answer all your questions.
Thank you so much, Dr. Diana. Thank you so much for explaining all those details and walking us through all the IVF legislation and of course also surrogacy in Russia. I do think that it is much clearer for everyone right now. And yes, now it is time for your questions. So our Q&A is enabled. So therefore, go ahead, type those in. There are some questions already right here. So let's get to the first question that we have. What is the difference between PGTP and NGS24, if you can clarify?
It's just different technologies. NGS24 is so-called PGTA, so we can investigate all the chromosomes. And PGTP is pre-implantation genetic testing for polygenic diseases, for example, diabetes. So it's just different technologies, and the aim of each of these investigations are very different. So NGS24 is like a screening method. We investigate all the chromosomes, and PGTP is investigation for specific disease, for example, diabetes.
Thank you so much indeed for the clarification, and thank you for your question. Angela has added one more question right here as well. Have your donors been pre-screened for genetic carrier testing diseases? How many diseases are tested?
Yes, for sure. All the donors have a screening method for the karyotype. It's like very rough testing, but all the donors also undergo genetic carrier testing for the panel, which includes more than 200 diseases. But to complete this disease, we should make the same testing for intended parent, for the intended father. And then we analyze both data, not only from the donor, but we should exclude the match for any monogenic diseases. So we always provide this data for the on the karyotype, but to complete the data, if we have any risk for monogenic disease, we should also complete the same testing on this panel, also for the intended father.
Thank you for definitely interesting question, and of course for clarification to this one. Angela has one more question for you. What is the minimum AMH you require for your donors?
Well, as we guarantee at least 15 eggs, we always measure AMH. According to the European guidelines, lower than 1.0 is considered to be low. So for sure we make examination of the donor, but we measure AMH level, which should be at least 1.5. But we also assess antral follicle count, so this rate AFC, because we also have to be sure that we have enough follicles according to the ultrasound. So usually we make two tests to assess ovarian reserve, AMH and ultrasound scan. Okay,
again, thank you so much for yet another question and for your help. This time, Melissa has added, you mentioned this during your presentation, so what are the regulation of transportation of eggs, embryos to other countries? For how long can the embryos be stored?
Well, to say the truth, as the embryos are stored in specific specific so-called jars, so which are full with which are full with specific. So there are specific regulations. In our experience, the most a long transportation one was from Australia. So it was more than 40 hours because it was just in the heart of pandemic. So we have stock in UK, but everything was good, and nowadays we already have the embryos. So what I want to say is that we have specific courier system which has a lot of experience in transportation and shipping the embryos. So they have just their regulations and everything is very good and safe for the embryos.
So you definitely have experience. So this is definitely something you are doing every single day at the clinic as well, right? So that's good. Thank you. And also, as we are talking about this, let me go to this question. Is it possible to transfer embryos from Ukraine into Russia? How long would this take?
Usually, preparation for shipping takes about 2 weeks. So usually about 2 weeks from receiving the documents from your site, but we take 1 month, but we according to the contract we take responsibilities for 1 month, but usually it takes not longer than 2 weeks.
Excellent. Again, thank you so much for the clarification. Okay, sorry, there is a follow-up. Let me go straight to that one. Okay, so is clearance from Ministry of Health necessary?
I should clarify according to in terms of Ukraine specifically, but in all other countries it's not necessary.
All right. Thank you. Indeed. And as you can see, thanks from the patient for you right here. Okay. And well, we have another question, which is a bit of a topic, but it's definitely okay. I'm sure you can answer that if you can advise. Adenoma of 3.5, 3.8 centimeters, what do you think would be the right approach before embryo transfer? And donation embryo transfer, no indication to operate. Anything you can advise?
Thank you for your question. Well, I agree that the size of adenomyoma is not an indication for operation, for surgery, no doubt. But to say the truth, I need more information about the location of this adenomyoma, because if it's very close to the cavity and it alters the cavity or the endometrium, sometimes we recommend to make preliminary before embryo transfer to provide conservative treatment. For example, because I want to clarify if it's just leiomyoma or adenomyoma. Because if it's adenomyoma and we talk about adenomyosis, it's better to make conservative treatment. But for sure, yes. But if you don't mind, I'm ready to even to open and opened. I'm sorry. I'm a bit concerned about the doctor, about the last message that the doctor opened it and saw it. Because if we talk about adenomyoma, it should be approved according the surgical examination, hysteroscopy, and sorry. So no doubt, if we talk about such case, it's better to make conservative treatment. According to all the guidelines of treatment of endometriosis. It's better to make a treatment from 3 to 6 months given your specific case, it's better to listen to your physician. But it's better to make treatment before planning embryo transfer.
And thank you so much. And actually, there is one more follow-up. So let me just go straight to that. After a chemical pregnancy, it's necessary to do an ERA test. Doctor is pushing, but I think it is waste of time and too much medication in the body for nothing. If there was an implantation, anything you can advise?
Well, I do love ERA test, to say the truth, but I agree that it's not a routine method, and we have specific indications for performing ERA test. If you had several biochemical pregnancy or molar pregnancy, for sure it's indication to make ERA test. And sometimes, yes, biochemical pregnancy can occur if we do not match to the middle of implantation window. You also have a good point that the implantation has already started, but sometimes it's just not the middle of implantation window. That's why pregnancy initiated but stopped. So I have very limited data about your case, so I do love ERA test, but I do believe that we always have to have strong arguments and indications for each testing.
As always, thank you so much indeed for your question and your advice here. As always, you definitely need more details in order to properly help with the answer, right? So thanks so much still. And let me just remind everyone that if you would like to get some more details and you are able to get in touch with Dr. Diana Obidniak, and of course I will put the link right here. There is an option for you to get in touch with her that way as well. And I'm sure she'll be happy to help you out as well. Okay. And next question, possibly our final one. So if you have any left, you know what to do. Go ahead, type those in. And the question is, are experimental treatments such as PRP, IVIG, pronuclear transfer, mitochondrial donation performed in Russia? Do you offer any of such methods at your clinic?
Thank you for your question. So we have a very good experience working with PRP technology, but I should also clarify, because there are different methods associated with PRP technology. So by this moment, according to evidence-based medicine, there is evidence only for PRP in terms of recurrent implantation failure or so-called thin or resistant endometrium. And we do such a technology, so it can be perfusion or injection, but we perform it. If we talk about PRP as a stimulation of the ovaries, it doesn't provide good results. I mean, pregnancy, because according to the papers and our trial experiments, we obtain eggs, but it's usually called activation of ovaries in women of advanced age, reproductive age. But to say the truth, we cannot fight with the nature, and we cannot obtain healthy embryos. And as we cannot obtain healthy embryos, we cannot provide good pregnancy. So unfortunately, by this time, PRP technology is limited by using only in terms of recurrent implantation failure or in cases of thin endometrium. If we talk about IVIG, we also implemented in our practice, but to say the truth, there are very rare indications, also according to the evidence-based medicine. So it's only autoimmune diseases, and it's not really associated with recurrent implantation failure or infertility. When we talk about pronuclear transfer or mitochondrial donation, I think it's we should consider them as very prospective technology, but they are both experimental ones. So we perform such trials in the university, because I'm also an affiliated professor at the university, and we make it, but we do not perform it as a routine method. And we do not implement it in our work and our practice with patients, because it's a worldwide technology which is rather limited with evidence. So I think that these methods are prospective, but still there is lack of information and evidence.
Thank you for explaining all those details as well. It's definitely interesting. So for now, we just need to wait again for more data to be able to simply discuss it in more depth, of course, I'm sure. Thank you indeed. Okay, one more question. Two, actually, sorry. So two questions. So is embryo adoption possible? And if so, is there a waiting time?
Well, yes, embryo adoption is legal in case we make transfer into uterus of intended mother. So we do not talk about surrogacy in this mode. But to say the truth, there is no waiting time, but we make cultivation of the embryos just precise individually for each couple, because we should select the donor who is very close by her phenotype to you, and sperm donor which is phenotypically very close to your partner. So to say the truth, there is no waiting time. It's just we need some time, for example, a week for making to perform all the logistic details to select the donors, and we start cultivation. So it doesn't take much time, or maybe it's more correctly to say that it's dependent only on your preferences and the speed of selection of the donor.
Once again, thank you so much indeed for your question and explanation. Now it might be our final question. So again, if you have any left, you know what to do. And the question is, so do you recommend PGT in egg donation embryo that is already frozen 5B?
Thank you for a good question. All the questions are very good, but I think it's one of the very crucial points in actual IVF practice. When we talk about fresh cycles with egg donation, we always recommend to make pre-implantation genetic testing. As in your case, you have already frozen embryos, we should also weigh the risks and advantages from defreezing, taking biopsy, and then freezing once again. So if there are no severe defects in sperm and there is no severe male factor, for example, when there is a low count of spermatozoa or 0% of normal spermatozoa, I wouldn't recommend to make it to make defreezing, making biopsy, and freezing once again, because in all the situations it can affect the quality of the embryo and its potential for the implantation. However, if for any reasons, unfortunately, this embryo will not implant, for sure, think over about making another simulation with PGT testing. Thank you.
Thank you so much. You can see it right here. Of course, I'm sure there's a thanks for your answer, and we will be finishing for tonight. And as you can see, there are some things right here as well. Thank you for answering my questions. Most helpful. And well, thank you everyone for joining. Okay, this evening again, you are spending another evening with us, and you are still having interesting questions. And it's really nice to see that you find this interesting, because I'm sure you do. And Dr. Diana, as always, it's great to have you here. Thank you for explaining all those details. And I know that there are more webinars with you coming up for sure, no doubt, right? So I'm looking forward to them already. And well, as you can see, one more. Thank you. And before we finish, because I'm sure that some of you know, we will have a summer break and we will be back in September. And I already feel that we are coming to an end, and there's some sort of summary that we need to add. So, yeah, thanks so much as well. I know that Dr. Diana actually has a vacation very soon as well. So, yeah, thanks so much, Dr. Diana. You've been here many, many times before. This year, even you had presented quite interesting topics, of course, as well. So, thanks a lot. And before we finish, is there anything else you would like to add, as always?
Thank you so much. It was a pleasure to, take this evening with you. Thank you so much. I do believe that we perform a good deal when we make very good things. Having such a communication, I'm very grateful for your questions and for your time. Thank you so much, Caroline. You're brilliant as always. Thank you so much.
Thank you so much indeed, because it's such a pleasure, anytime, any day, Dr. Diana. So we are in touch as always. And of course, everyone, again, you know that tomorrow will be our final webinar before our summer break, but afterwards we will be back, so don't worry. And of course, thank you so much. It has been recorded, so of course you will find it tomorrow. It will be available on our site and YouTube channel as well. So have a relaxing and wonderful evening, Dr. Diana, as well. Talk to you very soon, I hope, as well. Okay? Thanks. Take care. Bye-bye.